this lower lid retraction after lower blepharoplasty? I'm 30 days post-op from an endoscopic brow lift and lower blepharoplasty. My lower lids seem to be drooping down on the outer edges. My right eye is more prominent than the left. The doctor has me doing rolling massage 3 times a day. I'm devastated by the outcome, but I haven't expressed concern about this with my doctor yet. I meet him again in 2 weeks. What is this, and should I call him sooner? Also, is it normal not to have feeling from the top of my head to my brow? I'm 50 and a non-smoker.
Thank you for your question. You're 30 days after endoscopic brow lift and lower eyelid blepharoplasty, and you're asking about eyelid retraction, and you've described one eye being worse than the other, and that your doctor has advised you to massage the lower eyelid, and you've also expressed that you're devastated, but you haven't expressed this to your doctor. So clearly you're looking for some additional opinions and some guidance. Well, first of all, being in communication with your doctor is so critically important. Your doctor obviously set out to do the procedure the best way the doctor knew how, and is following up with you in 2 weeks. So you are getting, from my perspective, the appropriate attention that you would need to deal with the concerns you have. The question about the numbness after endoscopic brow lift is a reasonable question, and it is not at all unusual to have numbness, so you can be clear about that. There are nerves in the forehead specifically that provide innervation or sensation to the skin of the eyebrow and the scalp, and swelling can really have an impact on that. And so typically I tell my patients that this is not only common in endoscopic brow lift, but also in facelifting. In facelifting, there'll be a region of numbness that gets smaller and smaller as time goes on. So, as far as the lower eyelid retraction is concerned, as a cosmetic oculofacial plastic surgeon who specializes in eyelid complications in revision surgery, I have a lot of experience with lid retraction. When people come to me as early as someone like you have, I would generally, if there is no clear indication medically to pursue any revisional procedure, then conservative management is usually the first line of treatment. Now, conservative management includes massage. You see, when lower eyelid surgery is performed, sometimes the eyelid can look relatively retracted, but not because of a complication or a healing complication, but rather just from swelling that causes the muscles of the lower eyelid, called the orbicularis muscle, to be having a little bit less tone. So there's a relative sag. Sometimes I've described the lower eyelid like a hammock, and this hammock can, when it's loose, can sag. So if your doctor noticed on physical examination that the lower eyelid is tight or pulled down, then massage can help that. Now, there are exceptions to this. We have had many patients who have come to us whose eyelids were so pulled down that their eye was exposed, or the outer corner of the eyelid was not connected, and they were not only having an overriding of the eyelid where the eyelid was irritating, the upper eyelid was riding under the lower eyelid, and the eyelid was getting irritated, and also the eyelid was so away from the eye that it was causing a lot of ophthalmic issues. And anytime there is an issue that is potentially vision threatening or at least ocular health threatening, then we do things a little bit more aggressively. So it seems that your doctor is on the right track of management. Now, when things do settle, you may feel that their eyelid is retracted more than you want. and then a revisional procedure may be indicated. So it is very important that you continue to communicate with your doctor. Understand, no one knows the anatomy of your eyelid better than the surgeon who operated on you. Assuming that the surgeon also did a proper preoperative assessment, understanding that there are definitely times when, in the best of hands, procedures may need some kind of revision procedure, that your surgeon will work with you and do whatever enhancement is necessary if it's indicated. So at this point, I would say that your best option is to still work with your doctor and see where the eyelid goes as your healing process continues. So I wish you the best of luck. I hope that was helpful, and thank you for your question.